Hi, my name is Dr. Ted Chapin. I'm a licensed clinical psychologist and a licensed marriage and family therapist. I'm also trained in neurotherapy. In the last 25 years of my practice, as you, I've worked with clients primarily through counseling and medication to help them resolve their psychological and behavioral problems. Today, we want to speak with you about neurotherapy.
And I'm Dr. Lori Russell-Chapin, and this is my partner, Dr. Ted Chapin. And Ted and I have been working together for a long time in private practice. I'm also a professor at Bradley University in Peoria, Illinois, and I'm a licensed clinical professional counselor and a trained neurotherapist. What we're finding in our practice is that sometimes people come to us and they have the same problems. They've been to other therapists, they've been on medication, and something's just not quite right. And so what we're finding is that neurotherapy, or it's something that's called neurofeedback, is just the ticket that we need to help our clients help regulate their brain. And so we're excited to talk to you today about neurotherapy.
All problems at their core are neurological. We already understand that the brain operates on both a chemical and electrical basis. However, most of our focus and treatment has been on counseling and on medication to deal with that chemical basis. Today, through neurofeedback, we now have the ability to refocus on the electrical activity of the brain. Using the science of neuroplasticity, we now know that the brain has the ability to create new neuronal pathways. Neurofeedback relies upon EEG technology, advanced computer software, and principles of learning to help clients re-regulate their brain functioning.
Today's program will review the fascinating technology behind neurofeedback, the basic tenets of neurofeedback, and the efficacy rates behind neurofeedback. You will also have the opportunity to observe my doing a neurofeedback session with one of my clients. But the real goal of our program is for you to be able to harness this technology so you too can use it in your own private practice. We've been talking about neurotherapy, and in our introduction we talked a little bit about the three methods for the treatment of psychological and behavioral problems. And we mentioned number one would be psychotherapy or counseling, number two medication, and of course number three neurotherapy. So I was thinking through that it might be nice if you would talk a little bit about the history and then we'll define it.
Sure. Some of the early research in neurotherapy began in the 1960s with Joe Kamaya. He was at the University of Chicago, and he began working with deep state training or relaxation and meditation. After Joe, the research moved on to Barry Sturman, who worked out of UCLA, and his focus was more on seizures. In fact, he worked with NASA later, and he worked with cats. What happened was that they found pilots were responding pretty poorly to jet fuel, and he could use the cats and expose them to jet fuel, and that neurotherapy would help these cats keep from having seizures. And he later applied that research to human beings.
And so this field is, it's relatively new, but it's about 40 years old, and now we're progressing more into the human population.
Yeah, more recently in the 1990s, Joe Lubar worked with children who have ADHD, or attention deficit hyperactivity disorder, and he found that another form of neurofeedback would help them reduce those symptoms and even alleviate the need for medication in some cases.
And so what we're finding is that now, as we're moving into this 40-year history, there are some wonderful controlled studies on the efficacy of neurofeedback,
Right.
And we're just getting slowly and more progressively information about the importance and effectiveness of neurofeedback.
And then finally, Peniston, doing work with folks with addictions, found that he could help reduce the frequency and occurrence of relapse by using yet another form of neurofeedback. And that was pretty astounding, because what he found was that this type of neurofeedback also helped people who had trauma or post-traumatic stress reactions.
We're really defining neurotherapy now, and I think it's so interesting that in the literature what I find is that there are so many different words that define it. They say neurotherapy, neurofeedback. Probably my favorite is biofeedback for the brain. That one makes sense to me. I've heard non-invasive brain surgery, although I really don't like that one, but I think that's another way that they have been used for neurotherapy. I love the neurological tune-up. That one I think is really, really nice, because that's what we're doing, trying to make the brain, as we get into this, more efficient.
Function more efficiently.
Yeah, and more effectively. And I think another one is, I've heard people say it's a primary method to correct brain dysregulation. And we're going to talk more about brain dysregulation too.
More technical, but very accurate.
Mm-hmm. So there's some nice terms that we can use for neurotherapy.
Yeah.
What about a definition?
Yeah, neurotherapy utilizes EEG, or electroencephalogram, and computer technology, which allows feedback of electrical activity of the brain to computer software. It's a really fascinating process. When someone sits down for neurotherapy, we hook them up to these wires that read their brain waves, and then that activity is transferred over to the computer program that affects it in some significant way. So when they're in the proper brainwave range, the computer program will operate and a movie will play, or music will come on. Or if they veer off of that certain brainwave activity, the movie will stop or the music will stop. Neurotherapy is also based on principles of learning or biofeedback. Biofeedback is where we take external measures of our body's function and we learn to control or regulate those functions by just monitoring them. So for example, if we had a skin temperature hooked up to your finger, we'd be able to see how stressed you are. And as you raise that skin temperature, you'll become much more relaxed. We also use the principles of operant conditioning so that certain behaviors are reinforced and certain associations occur that strengthen the kind of response that we want.
We've been talking a little bit of what neurotherapy is and its definition, and I think it's very interesting to me, though. We've been talking about dysregulation, so what causes that dysregulation? And I think about the brain, when we're born, I think for most of us, we're born with a pretty lovely, healthy brain.
Right.
But there's so many things that affect us if we live a long life. And so I thought I'll tell you some things I think that might be really reasons for dysregulation, so jump in anytime.
Okay.
But to me, one of the biggest ones is, although I think we're born with a healthy brain, we have some genetic influences too. So we could be born with something that would influence our behavior. And then inheritance would be positive as well as negative. I think of other things as children are being born, what kind of conditions are they born under? I mean, was there alcohol abuse, was there drug abuse, poor nutrition perhaps of the mother?
Or were there problems with the pregnancy?
Yeah, so a lot of prenatal kind of concerns.
Or a birth process?
Yeah.
Was there oxygen deprivation?
Yeah, so there could have been some brain trauma at birth. I think that's really interesting. And as we live a longer life, what if we had a high fever, or what if we had some diseases? Those kind of things would affect our dysregulation in the brain.
And living or growing up in a suppressive kind of emotional environment where there's neglect or abuse certainly can cause the brain to less develop, as well as head injuries. How many kids take a fall now and then? Maybe things we consider very innocent, a sports injury or accident.
Falling off the monkey bars like you did.
Falling off the monkey bars, falling down while ice skating, playing football, falling off of a bicycle. These are things that can affect brain functioning.
Possibly concussions.
Concussions.
Perhaps being in a car wreck and having a traumatic brain injury. Those kind of things would make a difference too. We talked a little bit about drug and alcohol abuse prenatally, but as we get older and if we abuse drugs and alcohol, that's going to affect our brain in our early adolescent and our adult life, as well as some of the medications we use. Extended uses of medication, I think that's going to impact our brain too.
Right, long-term use of medications can affect neuronal functioning.
I look at even in many of the illnesses we might have, but if we have chronic pain, that's going to affect how our brain functions.
Chronic pain, seizures, strokes?
Yeah, absolutely. That certainly impacts the dysregulation in the brain. And then, of course, the one that probably none of us really like, but there's some normal cognitive decline with aging, and that's going to impact and have some dysregulation in the brain as well.
And over a lifetime, we may be exposed to certain toxins that also accumulate in the brain. Lead poisoning would be an example, or mercury in fish. These things can also affect our function.
So there's so many things that might cause dysregulation, and that's where neurotherapy comes in.
Right.
Things that can help it maybe impact and regulate to a more efficient state.
Right.
We've been talking about sources of dysregulation, so it makes sense that we probably need to talk about the actual goals of neurotherapy. And I think there are several of them. Probably the biggest one that I can think of, though, is that it normalizes the brain functioning. And what I love about this piece is that in the literature it talks about how brains usually function in 3 different arousal states. And one is the overactive or over-aroused brain, the under-aroused brain or the unstable brain, and the over-arousal brain probably is a little bit like mine, kind of busy all the time. The under-aroused brain might be more laid back, like you, Theodore, and you're smiling. And then the unstable one is, I don't really like that definition, but you said something to me one time that made a lot of sense, and it's that piece of our brain should be able to kind of go through each of those brain states. And so I love that terminology of having the brain do the right thing at the right time with the right task.
Yeah,
And if they couldn't do that, that would be the unstable brain.
right. And what happens over time, if we are under a great amount of stress, we'll become over-aroused, and we'll have problems with anxiety or panic attacks or sleep problems, insomnia. And of course, when we can't maintain that kind of distress for a long period of time, so eventually we reach an exhaustion phase. And that's when we'll become more low aroused or under aroused, and we'll fall into depression or trouble concentrating or inattentiveness. And that's a frustrating state to be in. Probably more difficult, though, I think, is that instability state. And those are folks who struggle with problems like bipolar disorder or panic disorder or migraines. There's an instability in the brain, and neurofeedback sure can help remedy all those conditions and bring it back to normal functioning.
So if we go back to that, it's the inability of the brain to do the right thing at the right task with the right time.
It is that, but also bringing it back to a more normal state of operation.
So then the real goal is to normalize the brain, to make it more efficient, and then I think there's another piece that might be, which is to optimize our performance in life.
Yeah, neurotherapy isn't just for clinical problems. It can also be used to help improve personal performance. So athletes, artists, dancers, musicians, business people could all do better by improving their optimal brain performance.
We've been talking about sources of dysregulation, we've been defining neurofeedback, and I think now we probably better move into that. How does it work? What's the process of neurofeedback? If I had to give you sort of the how does it work picture, we're really trying to find the neural activity of the brain and looking for specific electrode placement. You can do a 19 channel, we can do a 5 channel, we could do a 1 channel, a 2 channel. There are lots of ways that we can get that neural activity. And then you take that along with that computerized program and run some really nice software. And when I'm doing neurofeedback, I find that I'm utilizing tones, perhaps, puzzles, videos, games, music. And then as the person who's doing the neurofeedback, what I'd be doing, or you'd be doing, would be either to inhibit the brain waves that we don't want, and then we're reinforcing the brain waves we do want.
Right.
I heard someone tell me it was often like riding a bike too. I heard someone say that, I often have clients ask me this question, well, how do we do this? Can I make it? And you really can't do anything? And this is the piece I think is so interesting, and I like this term, that the brain's this wonderful coincidence detector. That if you don't know what you're doing and maybe the things aren't going quite right, the brain will figure it out. And so it is like riding a bike.
Yeah, it'll begin putting things together, so it'll know what to pay attention to and what not to do. And it will follow along and strengthen its own response.
What do you think the process looks like?
Well, in doing neurotherapy work, we sit down with the client and do a pretty thorough initial assessment. This involves looking at their current problems. We look at a screening for anxiety and depression and trauma, and we do a 5-point EEG analysis. What that means is that we hook them up to the EEG equipment and we try to see where their brain waves currently function at and compare that to a norm. And then we get a report back that helps us devise a treatment protocol for that individual. And that protocol is then used to set up the training with the computer software and the EEG equipment.
And so along with that protocol, we're also doing some behavioral assessment too. You might ask them, what symptoms are you presenting right now? And then try to do symptom reduction along with the other things that we're using in neurotherapy. And then would you say at the very end, we certainly implement the protocol, but at the end, I think this is probably is most important, we're assessing our progress.
Over time, we have clients complete an ongoing checklist of their current problems to try to note improvement or to figure out how to adjust or readjust that treatment protocol that we have. And we can also do a trend analysis of changes in their neural functioning, which is really fun for clients to see over time, that changes in alpha waves or delta waves.
So they might have started here on alpha, but after maybe 17 or 20 sessions, they might be going up here, depending on what we're trying to do.
Correct.
Earlier, we talked about the whole protocol involved in doing an actual neurofeedback session. So what we're going to be doing now is demonstrating that neurofeedback session from beginning to the end. Okay. Thank you so much for agreeing to do this videotaping with us. I think it's a piece that will help so many people understand neurotherapy better. But first of all, you've given me consent and permission to do the videotaping.
Yes.
Okay. And also consent to talk a little bit about your story.
Absolutely.
So let's talk about that a bit. We've been doing therapy for about 2 years together. Is that right? Okay.
I think so, yeah.
Okay. And mostly that's been cognitive therapy. You came to me with a diagnosis of bipolar disorder, and I think we set some wonderful therapeutic goals. And then in about November of last year, we talked about doing neurotherapy.
Right.
And so we've done 17 sessions of neurotherapy together. And here's what I wanted to share with you. I think this is so interesting. I'll give this to you, but this is actually a symptom checklist of what you told me you were experiencing in November of last year. And you wrote down 12 symptoms. What are some of those symptoms, Michelle?
Agitation, anxiety, difficult falling asleep, racing thoughts, negative thoughts, attention and concentration troubles, spaciness or fogginess, motivation issues, irritability, forgetfulness, feeling blue, memory.
Wonderful. And so there were 12 of those.
There were.
I'll take this one. And then if you remember, each time we do neurotherapy, I give you another rating of a problem change, and you can tell me, do you think these problems are the same? Are they better? Are they worse? Right. And today you just did this one, and I think it's interesting that really none of those that you put down in November are there.
Overall happiness is better. I'm notedly better organized, have clearer thinking, my attention, of course that goes with that, is better. Having my act together all around. Ability in tasks requiring several steps. I remember when I first started that was hard for me, and it's much better now. The only thing I noted from last time that was worse was my snoring, but I think I have allergies.
Okay, so it has nothing to do with neurotherapy,
No, it
huh?
doesn't.
Okay. Michelle, could you, before we get started and hook you up, could you tell me, it's been so much fun doing neurotherapy with you, and the day I got to see you praying on my EEG was pretty phenomenal.
Yeah, that was
But
fun.
could you describe for the audience what you think neurofeedback has done for you, or what it's been like for you?
It's an overall sense of well-being. That's the best way to explain it. Well, one of the things that I noted right away when I started in November is that for the first time in my life I had all my Christmas presents bought by December 1st. Wrapped and bought by December 1st, which I just noticed that was, and in the mornings especially, I'm on task. But more than that, I think I'm just a lot calmer. I seem to take in everything in the day. It just is easier to handle.
And so as we've talked, and this is the cognitive therapy as well as neurotherapy though, it's that whole piece of being able to respond and not react. That's that's the big change, Michelle, that I've seen.
Exactly.
The other thing that we need to tell the audience is that what I've been doing with you is SMR protocol training. We talked about that a little bit earlier today, but what I'm trying to do is train at 12 to 15 hertz, and the whole function of that is to help you become calm or calmer and focused. And would you say that we are working towards that goal? That's been
most definitely.
wonderful.
Most definitely. I can, and I've said to you before that when I'm doing neurofeedback, it's really to calm to be still your brain and your mind and let the information come to you rather than going out to get it. That's the best way
to describe it.
Because I think when you're anxious, you go at things instead of letting them come to you.
And I know it's a little difficult today because we're going to be having a video camera on us.
Right.
So I really appreciate your doing this.